Hi, and welcome back to my channel. I wanted to come in and just have a seat with you all and talk about my recent scare with breast cancer. I wanted to record this video sometime in October for Breast Cancer Awareness Month, but I'm just getting around to it now. Well, that's okay because I have some information that I want to share regarding my updates. So in a way, this video is sort of right on time. So back in March or April of 2023, I noticed a lump in my breasts which felt different. Now, I have fibrous or dense breast tissue, so lumps aren't something new to me. For those who aren't familiar, dense breast tissue is something a lot of women have, and it can make it difficult to spot certain changes or masses on imaging. But this lump, it felt again distinct enough for me to feel like I needed to check in with my primary care provider. So I scheduled an appointment with my PCP, and in that appointment I explained to her what it was that I was feeling. So she didn't feel the lump herself or ask me too many questions, but she told me because I felt a significant change that we'd go ahead and order a mammogram and an ultrasound. So she said it was the new standard. I'm not sure exactly what she was referring to, because the guidelines have been pretty consistent. I didn't see many changes regarding breast exams, but I could be wrong. I'm used to, as a nurse practitioner, going in on my patients and getting hands-on. Like, I want to feel the lumps. I want to see what it is that you're feeling, to see not only does it help me with my hands-on skills and being able to properly diagnose my patients, but I think it's just good practice. But so part of me was like, so wait, you're not gonna feel this lump? Come on. She basically was like, no, it's the new standard. I don't have to, feel the lump. If you say it's there, I believe you. We just send you for imaging. And that was new to me. As a nurse practitioner, I'm used to going in and, actually placing my hands on a patient, and I'm actually used to, as a nurse practitioner, going in and doing breast exams, possibly because I'm in women's health. It's routine for me, maybe not so in family medicine, I'm not sure, but nonetheless, I was like, hey, she's gonna send me for imaging regardless. So we just skip a step. Instead of her feeling forward, let's just see what the imaging says. And I can agree with it. I can see the logic behind it. I'm the one that's taking a feel for the breasts. I'm the one that's feeling my breasts and doing the home breast exams at different times throughout my menstrual cycle. So I sense when there's changes. I know when a lump feels different, or if it's growing, or if I felt a new lump. And in this case, I felt something different. It did not feel like the lump I previously had concerns over. So in this case, I felt something different. It didn't feel normal to me. It didn't feel like just normal breast tissue. So to fast forward a bit, I was able to schedule my imaging for May 14th, which was right in that ideal time for me, because with these type of scans, if you aren't familiar, so for those of you who aren't aware, it's generally recommended that you have a breast ultrasound between days 7 and 14 of your menstrual cycle. And that's because during this time, breast tissue tends to be less dense due to lower hormonal levels. As you know, your breasts are more tender at certain points of the menstrual cycle. So it does help to test during this time frame for that reason. However, if you have irregular cycles or you are postmenopausal, the timing on that can be a little more flexible, but it is still something to keep in mind if you're menstruating. Thankfully, my cycles are pretty regular, so I was able to fit my appointment right in that window. So let's talk about the appointment itself. I went in on May 14th, again, trying to keep calm, reminding myself that I've been through this before and everything had turned out fine. But when the results came back, they painted a pretty different picture. So according to my mammogram, my breast parenchyma, I think that's how you pronounce it, it was described as being heterogeneously dense, which basically means that the breast tissue is a mix of dense and fatty areas. This density, it can make it hard to see subtle changes. But they also noted that there was a 15 millimeter oval focal asymmetry. Now, I'm being intentional and describing exactly what the report said because when reading these images, words matter. It matters greatly, especially when deciding on the next steps. So this 15 millimeter oval focal asymmetry, it was located in the right outer quadrant. So my right breast, on the right side and on the outside. And this was enough for them to catch attention. Like I said, I had both a mammogram and an ultrasound. Now that was the mammogram. So on the ultrasound, they found a mass that corresponds to that same area. And it said measuring 15 by 15 by 6 millimeters, located at the 11 o'clock position and about 4 centimeters from the nipple. Remember when I told you that words matter, especially when reading imaging reports. So it wasn't just any mass. It was described as having mixed echogenicity, not well circumscribed, and showing vascularity. Again, words matter. When they say vascularity, it means blood flow was detected within the mass. And this can be concerning. This is one of those signs that warrants further testing. Now, I shared that I have dense breast tissue. Let's talk a little bit more about dense breast tissue for a moment. So to give you all a little context, dense breast tissue can make it harder to see certain types of masses on a mammogram because the tissue appears white, just like it would in any abnormality. So this is why if you have dense breasts, it's often recommended to get both a mammogram and an ultrasound. Now, the ultrasound can pick up on details that might be missed on a mammogram alone. Also, for African American women like myself, dense breast tissue is more common. There is also a higher risk of developing aggressive breast cancer types. So my report concluded a recommendation for a biopsy, and the final assessment was given as BI-RADS category 4. Now, for those who aren't familiar, BI-RADS, it stands for Breast Imaging Reporting and Data System. It's basically a scale used by radiologists to help communicate the level of concern about what they see on the imaging. I'll explain it a little further in detail later on in this video. When I first saw that I was labeled BI-RADS 4, my mind immediately jumped to the worst case scenario. But here's the thing, the radiologists, they didn't specify whether it was BI-RADS 4A, 4B, or BI-RADS 4C. So I was left pretty much trying to interpret what this actually meant. Now, had the results shown a BI-RADS 4A, I might have felt a little more comfortable waiting to get my biopsy. But if it was a 4C, well, my decision moving forward would vary a ton. I mean, I knew the only way to be sure was to do a biopsy, but still I wasn't ready to jump into a biopsy. Instead, I spent hours researching everything I could about breast imaging, BI-RADS categories, and what my results could mean. I mean, I read every line of my report, looked up each term, and even opened the images myself to try and understand what it was that I was looking at and compare it to what they seen. For example, the report, again, it said the lump was at 11 o'clock. Which was 4 centimeters from the nipple with mixed echogenicity and not circumscribed. I literally was scrutinizing the images myself, wondering if I could see what they saw or if I'd somehow missed it. So here I was, feeling torn between moving forward with the biopsy and the lingering doubts I had about it. I couldn't shake the feeling that maybe, just maybe, I needed a second opinion. I mean, we were talking about a procedure that would involve inserting a needle into a potentially cancerous mass. At that point, I decided to reach out to somebody who might be able to help me get a clearer picture. An ex of mine is an anesthesiologist, and while he doesn't specialize in breast imaging, he did connect me with someone who does. So I got a chance to talk with an experienced radiologist, and her opinion made all the difference. Not only was she well versed in breast cancer imaging, but she was able to speak to specifically the challenges that women of color face in navigating breast health concerns. She took the time to explain things in a way that I can understand, going over the imaging and the likelihood of different outcomes. In her experience, even though my case wasn't emergent, she still recommended that I get a biopsy. She did understand my fears, but she also emphasized that the only way to be certain was to get a biopsy. You know, I'm actually grateful for that conversation. It gave me the push that I needed, and after thinking it over, I finally called the scheduling department and set up the biopsy appointment. But let me tell you, it was not an easy decision at all. One thing I want to stress here is the importance of being informed and getting a second opinion. It is okay to ask questions to get clarity and to make sure you're comfortable with the decisions. However, if you're ever in this position, don't let fear hold you back from taking the necessary steps. I know it is scary. I was scared too. But in the end, the reassurance and the clarity that she provided, I think made all the difference. If anything, it reminded me the power of advocating for yourself and your health. So even after talking to the radiologist, I eventually got a biopsy. The biopsy was not my next step. Like I said, I was unsure if I wanted to even have a biopsy. Because I have an aunt who had a history of breast cancer, and I have dense breasts, and I'm African American, I felt like all of those factors warranted for me to have a breast MRI. I did end up again advocating for myself and asking my PCP if she could order an MRI for me. So I did end up having a breast MRI done, and the breast MRI said the same thing. So eventually I ended up having to have the biopsy anyway. I really was trying to avoid that biopsy altogether. Again, I am my own biggest advocate, and I feel as though no one knows me better than me. Being that I have a medical background and that I enjoy researching and learning about these things, I really just wanted to make sure I was getting the gold standard of care. And I plan to, in fact, I will be uploading a video regarding breast cancer screening and awareness, and I'll go over some of these topics in depth. So based on my MRI results, it basically said they recommend a biopsy. There's no changes to their recommendation, which honestly, it was the only thing that was going to give me a peace of mind as well. I knew after reading their result and their impression of the MRI that was my only option. In this case, I weighed my risk versus the reward, or the pros and cons, and I decided to move forward with that biopsy. So before we wrap it up, I wanted to do something a little different. I received an email letting me know that my results from my 6-month follow-up are ready. So I was scheduled to have a repeat MRI at 6 months. Instead of having another mammogram and ultrasound, it was recommended that I have a repeat MRI at 6 months, and which I did. I did not go over those results yet. I didn't open the email. I said I'll wait and open it live in real time on camera, just to give you guys a little. I figured that I would open it in real time and on camera. So let me go ahead and pull up that email. I hope with this new site I can also see the images. These images have been provided as reference only. Interpretation of radiologic images should only be done by qualified clinicians. You should only review these images in consultation with your provider. I'm looking at some of the imaging. It's also interesting to note, when they did the breast biopsy, they did leave behind a clip. So a little piece of metal at the site where they did the biopsy. That way, if any new lumps or bumps develop, they will be able to determine if it's new or not by that clip that they left in place. I'm looking at the images. Don't like the way they look. I don't know what I'm looking at, but that doesn't look fun. Especially being, this looks different from what it looked like before. It scares me, honestly. There's a lot of things lighting up on here, which is why I was afraid of doing that biopsy. I'm getting hot, but I think the doctor would have called me, right? It did not look like that before. I don't like it. I'm almost afraid to read it. I'm just looking at the pictures. I don't know. This was my fear. My fear was doing a biopsy and then just setting off a cascade. I don't know. Before I look at the results, I'm just gonna pray. My doctor would have called me, right? I mean, I didn't get a message or word from her. Let me just go and read what the image says. Oh, if y'all are looking at the images and you see all of that stuff lighting up on the page and you're trying to figure out, I don't remember seeing that before. It lit up like a Christmas tree. So to go back and see what I just read is, God, thank God. Thank you, Jesus. Okay, let me print this out. It says comparison is made to all available breast imaging. Can't even read. They use a 3 Tesla breast MRI with IV contrast. The last MRI I had done was on July 2024. It says history of right breast, benign biopsy, family history of breast cancer. It still says the breast tissue is heterogeneously mild fibrocystic changes. In the right breast at 11 o'clock, 4 centimeters from the nipple, corresponding with the previous MRI, so it's the same lump in the same location. It says there is a 9 millimeter focal mass enhancement best seen on axial image 96. I'll go back to that. This appears stable to slightly decreased in size cyst with interval biopsy. No axillary or internal mammary lymph nodes is seen. Lymph nodeopathy, basically, that's when you start to see those lumps, and when cancer is in the lymph nodes, that lets you know it's further progressed. But basically it says there is no lymph nodeopathy. I don't even know how to pronounce that. Impression, stable to decreased in size, focal enhancement of the right breast at 11 o'clock is consistent with benign pathology results of the core needle biopsy. The recommendation is that I have an annual mammography. So it's basically recommended that I have an annual mammogram. And here's the thing, that this is also good news. It's now BI-RADS category 2, which is benign. I am so grateful, because before, like I said, it was a category 4. So as I shared earlier, I am making a video. So I want to remind you and myself that knowledge is power. Whether it's good news, unclear news, or something that requires action, it is best to face it head on. Even in the midst of uncertainty, it is best to know and face it head on than to sit in uncertainty. Thank you all for coming back and watching. And if you are navigating something similar, please remember that you are not alone. And if you found this video to be helpful or empowering, don't forget to like, share, and subscribe so more women can find this information. Let's keep advocating for ourselves and our health together. See y'all in the next one.